Just very briefly, Dr. Dinosaur seems to get a lot of good ink. Catamount maybe Health less so. Are those two programs, or what about those two programs? Should they be kept?
Well, I think that they're going to be kind of mooted by an inevitable move to single payer. I think that coming out of S88, we've got the three options coming, the three design options coming from Dr. Sal's team. I am certainly open-minded to whatever is going to give us universal access and healthcare containment, cost containment. But single payer is really the inevitable solution. We've been moving toward that for quite some time. It is the most fiscally conservative way to deliver healthcare. It will allow us to cut costs 5 to 6%, cut labor costs 10 to 12%, and will give us a healthier workforce that's more productive, and I think that we need to really just stop with some of the scaremongering tactics and actually just move forward to help our small businesses and our working families.
Lynn, single payer?
Well, not sure that we're going to have a single payer.
Not sure.
Yeah, I think that there is a study that's going to be interesting to see what the consultants come up with as solutions. Education and health are a lot similar in their structures and their costs. 65% of hospital expenses is labor cost. Education, 80% of their expenses is labor costs, salaries for staff. That's obviously the biggest, that's where the money is, so that's where you're going to have to go to cut costs. The problem with state and federal programs is that they pay 50% on the dollar for the actual cost of it, and the cost gets shifted to the commercial insurance, the private employers. So that's a concern. If you have single payer and you eliminate your cost shift providers, who makes up the difference?
But again, we're just getting close on time, close to the end here. What about Dr. Dinosaur and Catamount Health? Do you like them? Should they stay? Should they be looked at like anything else?
Well, Catamount is an insurance product that is subsidized by the state. Dr. Dinosaur is basically a Medicaid program for children. VHAP, it's part of that whole federal, state, and program.
Yeah. Quickly, Dr. Dine.
I
know it's a huge issue.
Yeah, I know it. But on the single payer thing, I want to see what happens. There's 15 states suing because of the Obama
national healthcare legislation.
I'd like to see what comes out of that and then come up with a conclusion, the path to follow. We've had, we have a Medicare, Medicaid, that's federally run. And, there's a model already in place, so we aren't really creating the wheel. Yeah. It's just the 1,600 pages that involved in that legislation can be utilized.
Ron, what about, again, Dr. Dinosaur, Catamount Health? Did the state get overextended on that? Are you comfortable with that?
I think on Catamount Health, they probably have. Dr. Dinosaur's worked fine for several years. I'm not too sure about the single payer, but even with the Catamount Health, before it was fully implemented, we were trying to figure out how to cut back on the services. Whatever you do, it's got to be sustainable. People can't get yanked around. We're giving you eye care. No, we're not giving you eye care. I think, we got to be careful, and I don't think single payer is the answer.